Joining us now is Mike Yudell. He's the chair of the Department of Community Health and Prevention at the Drexel University Dornsife School of Public Health. He's also one of the brains behind Study Hall, a great show at Fit Comedy. If we're ever allowed outside to go to theaters again, you should go check it out. A bunch of improvisers do scenes off of real stories from history told by experts. Mike, thank you so much for joining us.
Thanks, Tom. It's great to be here with you today.
So people who've watched our show before, either at the theater or the last episode we did, normally in this space we have a wacky character, be it a 1920s newsboy, the werewolf who is running for president, and of course the ghost of Richard Nixon, some of our favorites. You're not a character. You are a real person, correct? Real human being.
I'm a real person.
And a real expert in the area of public health. Tell us a little bit about what it means to be what you do and your expertise.
Sure. So as you said, I chair the Department of Community Health and Prevention at Drexel. We are a school focused on multiple domains in public health, from epidemiology to biostatistics to community health science, where my focus is to environmental health science and health policy and management. And we approach public health from an integrated basis that is rooted in an approach that thinks a lot about human rights and social justice, and how health inequities and health disparities shape and in many cases distort the public health landscape. And I hope we get a chance to talk about some of that in the context of the current pandemic. My specific work is on the history and ethics of public health, and I do both traditional historical work and also bring public health science to thinking about ethical challenges right now, particularly in the area of autism. So that's me, that's what I do. We are a great school of public health, and I am hopeful that in the wake of this awful crisis, more people pay attention to the importance of public health. We bear some fault, I think, and we can talk about this as well, about, why we are here and why the public was so unprepared, and why, frankly, the federal government was so unprepared for this mess. But public health also offers ways that we can together think about challenges like this and find solutions.
And amen about hoping we learn from this. So let's start right there. You know the history here. I'll give you a real leading question. If you were to grade the United States of America, the federal government, state governments, the individuals' response to this global pandemic, what grade would you give them right now?
Well, I think right now we're clearly working on a failing grade. We are all hopeful that grade comes up. And I think that failure, the grade is different depending on who we're talking about and which government entity or NGO we're talking about. If we were to focus on the federal response right now, I think there are some great exceptions, but for the most part, the federal government is failing. There's a failure of leadership and imagination coming out of the White House right now in terms of comforting people, in terms of using all of the levers that the executive branch has at its disposal to improve lives in the midst of this, to support doctors and other healthcare workers who are on the front lines of the pandemic. And you're in New York, and New York at the moment, probably alongside Washington State, are the two areas suffering the most, although there are some states and locales that are not far behind. Getting the president and his team to see the severity of this. We've all seen the clips that date back to January, when we realized that this was very quickly leaking out, or had already very much leaked out, of China to downplaying the crisis. And the messaging was, at the time, comforting to many Americans. And frankly, many of us, including those of us in public health, thought that the Centers for Disease Control and other federal entities would do their jobs to prevent outbreaks, and frankly, the worst outbreak on the planet right now here in the US. But that faith, as it turns out, was completely misplaced.
It's funny you mentioned his words of comfort. We talked a little bit about this last week, but I feel like I went from thinking, oh, this is a problem to, oh, we're in trouble, the minute he said it's not going to be a problem. The minute the president was like, well, there'll only be a few cases. This will be done by, I think, March or April or whatever he said, or in a few days. And I was like, oh, no, we're all going to die. So you mentioned before talking about some of the inequities that you've seen historically in a historical context. Talk a little bit about that, because I think that's a thing people aren't thinking about right now, because, you know, in such a, this isn't a physically tangible disease for so many people, right? The problem is not like they're noticing stores closing, they're noticing people wearing masks, you know, many people not yet noticing, you know, people sick, not yet noticing the physical the physical side of this. But beyond the physical side of just having a loved one or somebody you care about sick, there's a lot of tangible problems that are starting to crop up. And you talked a little bit about inequities. Talk about that.
Yeah, so I mean, health disparities, as we talk about them in public health, or inequalities, are both historical in nature. They're rooted in, you know, the nature of our society, in our social structures and economic structures. And in times of distress, they show themselves most severely. I was looking at a map in the New York Times earlier today that was showing the case count in different zip codes around New York. And it seems like cases are rising the fastest in lower income zip codes. And that is because, you know, people have to go to work. That is because of a variety of exposures, types of housing, et cetera.
Also, I would add to that just sort of maybe a lack of access to good medical care, or perhaps even a community distrust of good medical care.
Yep, and that lack of access is being seen now in hospitals. And in Elmhurst, Queens, which is a public hospital,
yeah,
we saw a piece again in the Times 2 days ago that they had 13 deaths in one day, and I sadly suspect that number is going to increase dramatically. But, you know, these types of inequalities have been identified by public health historians and scientists for more than a century. The great sociologist W.E.B. Du Bois was talking about those inequalities here in Philadelphia and identifying those in the late 1890s, not in the middle of an epidemic, but identifying how deeply racism and other types of forms of discrimination cut into people's lives, lessen their opportunities, and lessen their health. I think, you know, another piece of history that I think is important to pay attention to here that relates to inequalities is the way in which discrimination and stigma bear down on certain populations. And we have seen that throughout history in the context of epidemics in particular. And we're seeing it today, sadly, all the way at the top with the president and many members of his party, or some members of his party, continuing to call the COVID virus, the coronavirus, the Wuhan virus or the China virus, which serves no purpose other than to rile people up, to point to an other as being the cause of this. And if we look back to other infectious disease outbreaks in the past, groups in the United States who were not white often were identified and mislabeled as, you know, infectious disease carrying groups having high frequencies of different diseases, whether it be tuberculosis, pandemic influenza in 1918, or other diseases that ravaged this country fairly regularly during the late 19th and early 20th century.
Talk a little bit about the pandemic in 1918, if you can, just from that point of view, because I think we've already seen people, I think, who's it, Senator Chuck Grassley of Iowa defended calling the coronavirus the Chinese virus, because he said no one had a problem with us calling it the Spanish flu. And by the way, Grassley's old enough that he probably remembers calling it the Spanish flu at the time.
Yeah, Spanish
but
flu,
I think that was itself a discriminatory terminology, correct?
Yeah, I mean, my understanding is that the Spanish flu became known as the Spanish flu because Spain was a neutral country during World War I. They were reporting on cases which other countries were not, as a way to preserve morale during wartime. And that's where the name came from. Let's call it the 1918 flu as a more accurate historical name. And there are a lot of important historical comparisons. There are, of course, imperfect historical comparisons, but they can shed light on what we're going through today. And one way in which at least it's different so far is that case fatality rate was higher during the 1918 flu than it seems to be with coronavirus, although certainly when medical systems crash, as we're seeing now in Italy, and which threatens some big cities in the US, that case fatality rate will unfortunately climb. There were, of course, no antibiotics. Hospitals were not set up for long-term care, limited palliative care at the time, and healthcare itself was inferior as it would be compared to today. However, there are important similarities. There was government censorship and lack of transparency, as the name Spanish flu provides an example for. There was a lot of stigma and discrimination. The influenza pandemic of 1918 happened to coincide with a wave of immigration that would die down in the 1920s, but there were a lot of immigrants still coming from Southern and Eastern Europe, Asia, and other parts of the globe who were, considered a foreign menace, and the 1918 flu certainly didn't help that. Another important similarity, although it played out differently, was that fairly early on in the pandemic, U.S. public health officials recognized the utility of social distancing. Influenza would become to be called a crowd disease, which is, similar to how we think about it today. We know it's a droplet disease, and that coughing or breathing, on or near somebody can spread the disease. And there was initially tremendous resistance to this type of social distancing. Businesses resisted it because they didn't want to crash the economy. That may sound familiar, of course, because of course we'll be open and running by Easter.
By Easter.
And city public health officials in some major cities, including my hometown here of Philadelphia, resisted shutting down and prioritizing social distancing in the wake of this. And there is an unfortunate example of this in late September of 1918, as a wave of the pandemic was coming through the US. There was supposed to be a Liberty Loans parade down Broad Street in Philadelphia. The public health commissioner refused to cancel, partially out of political pressure from the mayor and other politicians in the city. It was it was to raise bonds for the war effort, so it was seen as a patriotic parade, and the parade went ahead. And it was an awful event in the history of that pandemic, because within 3 days, those 200,000 people who would infect each other spread the disease out into their communities, and within 72 hours, all beds in all of Philadelphia's 31 hospitals were filled with sick flu patients. Hospitals could not meet the demand. Patients were dying too quick to do anything. Families would bury their own dead at home. And then, of course, very quickly after that, Wilmer Cruzen, who was that public health leader who refused to cancel the parade, essentially shut the city down. Philly would go on to have the worst death toll of any city in the United States, with 12,000 people dying. And
one of them was
speaks to the importance of social distancing.
One of them was my grandmother's second youngest brother, who there was a photo of up in her home when she was alive. Of just, he made it to, I think, 3 years old before that flu killed him.
Hi.
So I guess a question I have off of that, we got a little bit of time left. Why, is it arrogance today? The arrogance of, well, that was 100 years ago. We have so much more technology, or we've so much more accomplishments. Is it or is it something else, that if we have this concrete example from history of how to stop these things, like what's wrong to do and what's right to do, why was there such a lag in confronting this? Why is there such hesitancy and debate over continuing these practices? What is it? Do people just not know their history, or is it something more insidious?
Well, it's probably all of the above.
Mm-hmm.
For a historian who teaches this material to public health students once, every fall in a class that's an overview that includes the history of public health, this feels chilling to me and all too familiar. As this was unfolding and as it got more serious, talking to my historian colleagues, we all kind of felt this weird feeling like, we're living through our expertise in a way that we hoped we never would, yet here we are. Why is that the case, and why are people resistant? I think people are not historically minded, and most people don't know histories like the 1918 pandemic, or the history of the polio outbreaks, or the history of measles in this country, the history of the bacteriological revolution. I could go on, but there is no shortage of examples of how we both failed and succeeded in the past in succumbing and or controlling epidemics. At the same time, I think it's human nature to be optimistic and to hope that something that feels unfamiliar and far away from us will not affect us. I think all of us who are healthy right now and sitting in our homes have a little bit of that feeling, like, we're lucky to be here and safe. But I can tell you that I've already had friends and family members who were sick. Gratefully, all are recovered or on the road to recovery, and it's a frightening disease. I think the thing that I would encourage your listeners and folks out there to think about is that we know how to handle these events. Frankly, there was a pandemic playbook, basically a Pandemics for Dummies guide that was handed to the Trump White House from the Obama White House that was scrapped. And that that speaks to the political nature of these events. And how political hatreds and tribalisms forced us to be, to some degree, in this position that we are. Now, I'm of course grateful that we passed this tremendous stimulus bill, but we also need to be thinking about the response as a team and not as atomized groups. And pandemics bring out the worst in politics, and we've got to move past that. These histories that we've discussed today show that, and they show the way in which stigma and discrimination can rear their ugly heads during these crazy times, and the way in which ideology can misshape people's approach to these events. I'm listening to Tony Fauci right now. He should be our national guru. We should stop having these political rallies essentially in the White House and limit the response to Deborah Birx and to Tony Fauci right now. Because history tells us that politicians have agendas.
Yeah.
Scientists have agendas too. But we have faith, and we need to have faith that those are data-driven agendas that can help mitigate the mess we're in, and get us as quickly as possible to the other side of this.
If nothing else, I think we need Lin-Manuel Miranda to do a hip hop opera on the history of disease pandemics, because that might get people to listen.
When we hang up, after this call, we can pitch it to him.
Let's do it. Let's get him in here right now.
All right.
Michael, thank you so much for your time. Thank you so much for your expertise. And as soon as I can leave my home again, I'll be down in Philadelphia to come check out Study Hall at Fit Comedy. Anything else you'd like to promote or plug right now?
Nothing to plug other than, make sure your viewers are washing their hands, staying with, outside of a 6-foot range from people who are not members of your immediate family. Only go out if you need to right now. Whether you are under quarantine or not, whatever state you might be in, you're self-quarantining will save lives. And that is a really important message that we all need to be passing on until we're on the other side of this.
Well, thank you very much for your time, Michael. And hopefully next time we talk about this, we'll be talking about the stunning recovery and stunning, sudden, dramatic end of this pandemic.
Let's hope for an antiviral that works, and let's hope for an effective vaccine as quickly as possible.
Amen.